Hi, I'm Cathy Riley from Flowminder presenting about data for good. As we all know, people move around a lot. They commute, they migrate, they move house. For healthcare professionals and planners, this creates big challenges. One, it's a factor in the spread of communicable diseases. And two, it affects the total number of people who are in a catchment area, which affects things like service demand and calculating statistics. How do you know how many vaccines, medicines, and antibiotics or oxygen to supply? How many births to expect? Or how much screening and testing needs to be done at a particular clinic or hospital if you don't know how many people it serves? And how do you calculate figures like disease infection rates if you have a constantly fluctuating but unknown denominator due to people's movements? What if I told you there is a way of calculating this dynamic denominator? And it involves tapping at the click of a button a continuous nationwide data stream of billions of data points generated by mobile phone users. And that it already exists in Ghana, it's just not yet used by the health sector, but it could be. This is a data visualization produced using mobile phone data from Vodafone Ghana. As you can see, it illustrates the daily flows of people across the country in 2021. For instance, we see clearly the higher volumes of people moving between the capital Accra and Kumasi, one of the large metropolitan areas in Ghana. And it's been used to inform government decisions already, like COVID-19 lockdowns and whether they worked or not. Every time you use your phone, it routes your call, text, or data session through a cell tower, and Flowminder has developed smart technology to analyze and aggregate this data to show how and where people are moving. We're now ready to make that information available to others. Imagine if Ghana Health Service could use this stream of data to guide its work, to predict disease spread, respond to outbreaks, target treatment campaigns, monitor performance, and measure progress towards targets. We can help make these dreams a reality. We've taken great strides already. We've signed a 5-year partnership agreement with Vodafone Ghana and the government of Ghana to produce mobility estimates, but we need to scale up their application. We can provide this novel data set to the people who need it most and turn that question mark into a number. We know the data is there. We know it can be transformed. And we know it can be transformational for Ghana too. But we need to get it into the right hands. Together we can, and we should, use this data for good.